Hi, let us be frank. Nobody wants to undergo a spine surgery. And if given a choice, we all want to avoid a spine surgery. But there are certain situations where spine surgery becomes inevitable. Like say if there is a tumor in the spine, if there is a fracture in the spine, if the spine is unstable and is not able to withstand your weight, if there is a trauma and there is a movement or an abnormal position of the bone in relation to your normal spine. So in all these cases, it becomes mandatory. But these are not common situations. The common situations are usually like a disc prolapse, like a canal stenosis, which are the common indications for a spine surgery. Now in these cases, many people do take time to decide or to say whether the spine surgery should be done immediately or they want to wait and watch. Now obviously there is an option of waiting and watching in these cases if the symptoms are not very severe, if the nerve is not getting damaged. But it is also important to understand when we should not delay spine surgery. Now this category, when we should not delay spine surgery, falls into two. One is when the nerve is getting affected. If the nerve is becoming weak, that means there is a progressive numbness, progressive tingling sensation. If the nerve is becoming insensitive, that means you are not able to feel sensation in a certain part of your limb, may it be the hands or in the legs. More progressive involvement of the nerve or compression of the nerve will result in weakness. That means you are having difficulty in moving a part of the body. There is a difficulty in moving the big toe. There is difficulty in moving the foot or sometimes the hand, or sometimes lifting the shoulder above your head. So in these cases, it becomes very important that it should not be neglected, and surgery, if it is going to be curative, should not be delayed. The other category is virtually pain. Now obviously different people have different thresholds for pain. Some people say that even a small pain they are not able to tolerate, and it is nothing to do with the character. A person has a different pain sensitivity pattern, and some people can withstand severe amounts of pain. Now this becomes a subjective phenomena where severe amount of pain also can be tolerated, or even small amounts of pain can become quite intolerable. Now it depends on the person when to choose to undergo surgery depending upon the pain. So if the pain is intolerable and it is not getting better with routine measures, not getting better with rest, not getting better with physiotherapy, not getting better with medicines, or you get partially better with physiotherapy and medicines and the pain keeps coming back and back every time you stop the medicines, if that is the case where it indirectly tells you that the underlying problem is not getting better. You are just feeling better because you are taking painkillers. You are just getting better because you are doing physiotherapy, but the underlying problem is still persisting. In those cases also, the surgery should not be delayed. So it is very important to understand these factors when surgery should not be delayed. But obviously there are red flags. Obviously there are cases where the window is so small that it has to be done as an emergency basis, and these are called Cauda Equina syndromes. That means, or sometimes when there is a spinal cord injury where the nerve is becoming so weak so fast that if you don't intervene in 24 hours, the nerve may probably undergo irreversible damage. So this window is very, very crucial, and this problem, it is important to understand. If there is a urinary or a bowel issue, if there is a difficulty in where the person is not able to stand on his own, in these cases surgery has to be done on an early or an immediate basis. Thank you.